than this. Reaching for the stars, traveling so far, like a dragonfly. Just grab my hand from heaven sent. With me tonight, I run away. Reaching for the stars, traveling so far, like a dragonfly. Keep your secrets there, hide them everywhere. Just you and I run away. I run away.
Breathe you in like oxygen. Oh, in an otherwise suffocating world, I'm reaching out for arms, I'm drowning in the open-ended love we're making, girl. Exhale the past, inhale a future that lasts. Change my heart, change my mind. For the last time, wanna believe in the life I've led. I don't wanna leave another word unsaid. You know my heart will follow you in tomorrow. In tomorrow. Shared my evidence you once really cared. I'm reaching for a hand to pull me up, one open to an everlasting love. Exhale the past, inhale a future that lasts. Change my heart, change my mind. For the last time, wanna believe in the life I've led. I don't wanna leave another word unsaid. You know my heart will
It's time for today's COVID-19 update. Bringing us the latest today is COVID-19 Response Minister Chris Hipkins and Director General of Health Dr Ashley Bloomfield. They are due in the Beehive Theatre shortly. Of course, we'll cross live as soon as the press conference starts. Everyone just getting in place now. First though, 5 Aucklanders may have received a dose of saline solution instead of the COVID vaccine after a mix-up last month. The people who received it still don't know, and Associate Health Minister Peeni Henare told Breakfast how it happened is still a mystery.
We are working on investigating exactly what took place there. We want to make sure that whether or not it was a simple human error or a process breakdown, I understand that this is an isolated case and the investigation is underway to make sure that we can identify what went wrong, but more importantly, rectify it.
All right, let's head to Parliament where, as you can see, political reporter Benedict Collins is standing by. Kia ora, Benedict. More locations of interest revealed this morning and it's more pain for supermarkets.
Yeah, it sure is. So we've had multiple countdown and pack and save stores in Auckland identified as locations of interest today. Now they are pack and save at Westgate, Mount Albert and Manukau. And for countdown, there's Victoria Street West and also Northwest Massey have been identified. Now be sure to get onto the Ministry of Health website to check out the exact times and locations that are being identified there on that website and to follow that advice there. Now we now have more than 480 locations of interest have been identified since this outbreak began just over a week ago. And Countdown this morning at 10 a.m, they put out a press statement saying that they now have 1,900 staff members in Auckland and Wellington having to self-isolate because COVID-19 positive people have visited their stores or that they in turn may have visited a location of interest as well. So clearly taking a really big impact on our supermarkets there. Countdown also said they've had 19 stores now that have been visited by someone who was COVID positive and that 6 of their stores are closed.
And there's another age group now eligible to get the vaccine. Tell us more.
Yeah, that's right. So as of this morning, everyone aged 30 and over is now eligible to get the vaccine, and that's been brought forward by the government. Of course, as of September the 1st, everyone aged over 12 will be eligible to get the COVID-19 vaccine in New Zealand, but they've brought that forward to try and speed things up. The rollout has been somewhat sluggish, and interestingly, as we're seeing in this current outbreak, many of those who are getting COVID-19 are not old enough even to be eligible yet to receive the vaccine. So this surely has pushed things along a bit. Now, I've just seen...
Sorry, Benedict, I'm going to have to interrupt. They're ready to take the press conference right now. Let's go to the podium.
Good afternoon, everybody. It's good to be back. I begin today with some good news, some incredible news, in fact. 80,000 New Zealanders got a vaccine yesterday, by far the biggest day that we've had since we started rolling out the vaccine in New Zealand. So a big thank you to those being vaccinated, those doing the vaccination, and all those working behind the scenes to make sure the vaccinations can happen safely under Alert Level 4. We also saw record testing numbers yesterday. Nearly 50,000 across the country, so thank you to everybody who's persevering and being patient, making sure they're getting their test. Every test that is processed helps us to understand and to track the virus so that we can knock it out. From today, if you're over 30, you can book in to get your vaccine. This is quite a shift towards one of our larger groups who have a very important role to play in keeping us all safe. I want to stress how important it is that we all get vaccinated. Nobody wants to be in lockdown, and the best way that we can return to enjoying the freedoms that we have had for much of the last year is to get very high levels of vaccination. So we do need to shift from things like our border restrictions and lockdown measures being our main lines of defence to vaccination being a much bigger collective defence against the virus. The 30 to 39 age band includes around 700,000 New Zealanders. I know a good proportion of them had a good laugh at my expense over the last few days, so my message to you is if you had a good laugh, I only ask that you pay me back by going and getting vaccinated. You can go online to bookmyvaccine.nz or call the COVID vaccination healthline on 0800 28 29 26. For the daily update, I'll now hand over to the man with the legendary poker face, Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Right, So today we are reporting 63 new confirmed cases since 9 o'clock yesterday morning. Of these, 62 were in the community and one is a recent returnee in managed isolation. This brings the total number associated with this outbreak to 210 cases. That is in the Auckland community outbreak. Of these, 198 are in Auckland and 12 are in Wellington. That's an increase of one case, as you will know, on yesterday's number for Wellington. This is, again, another close contact of one of our existing cases. There are currently 12 people in hospital with COVID-19, an increase of 3 since yesterday. 11 of these are associated with the current outbreak. None of those involved in the outbreak are in ICU. So with our current outbreak, the numbers again have gone up to 63 today, or actually 62 with the outbreak, and that's an increase of 48 from 48 yesterday. The good thing about this is, while this is steady growth, it is not exponential. We do know that our actions to slow and spread the virus will begin to see a slowing of those numbers increasing, and indeed the fact that the rate of increase is not exponential is explicitly because we have Alert Level 4 in place. Contact tracing, isolation, community testing and genomic tracing together with our wastewater testing are powerful tools to help us identify the extent of the outbreak, but the most important thing to control it is that people abide by the Alert Level 4 restrictions. At present, the majority of the links between cases are within households or workplaces. There are some cases that are identified who have been at a location of interest. In the vast majority of cases already, we are able to identify that link, and the exact person-to-person link is still being elaborated. As I said yesterday, a large proportion of the cases in the outbreak are of Samoan ethnicity. So I would like to reiterate my shout out of yesterday to the Samoan and Pacifica community in Auckland and to their community leaders for stepping up to support the contact tracing, identification, isolation, testing and vaccination efforts in the local community. Whaafitai, thank you. And as I pointed out yesterday, right since the start of this pandemic, it is our Pacific communities that have had the highest testing rates of any ethnicity, and particularly in our outbreaks, we see their testing rates go up very high, so they're incredibly responsive to the request to get tested. There are currently 6 epidemiologically linked subclusters identified within the outbreak. The 2 largest ones, as I talked about yesterday, are named Birkdale Social Cluster, associated with Case A, approximately 36 cases, and the cluster associated with the AOG Church in Mangere, approximately 105 confirmed cases now. The other clusters are under 10, and so I won't be releasing any names or details about those. Actually, there is one other associated with a set of Massey households and workplaces that has, from recollection, 14 cases, but the rest are all under 10. There are now even more locations of interest, and those currently being added are generally supermarkets more recently, some other locations of interest. My understanding is there were just over 40 locations of interest added today, and if you think about the large number of new cases, that's clearly a much smaller number than we have seen in other days. As a result of public interest, and as we've done in the past, we are now publishing on the Ministry website the demographic breakdown of the cluster, including gender, ethnicity and age group breakdown. That will be updated daily on our website. The number of contacts increases again, as we would expect, and commensurate with our broad approach we have taken to identifying contacts. As of 9 a.m. this morning, there were 20,383 individual contacts that have been formally identified. 12,717 of those there has been formal contact made with at 9 a.m. this morning, and 62% of those had already returned a test result. We now have a much larger number of contact tracers. 380 were trained yesterday from across government, and so in total, within the next couple of days, we'll have over 1,200 contact tracers in call centres around the country. Testing continues across Auckland today with 22 community testing centres. 4 of those are restricted ones, and they are designed to specifically prioritise and test people involved in some of our larger clusters. There's a new pop-up testing centre today in Mountford Park in Manurewa, and that will further increase the testing in South Auckland and make more testing more accessible to the Pukekohe High School community. Testing, of course, continues across our general practices and urgent care clinics in Auckland and around the motu, and I do want to shout out again to our colleagues in general practice doing all that testing. Wherever you get a test, it is free. On wastewater, there was a further detection of COVID-19 in wastewater in Warkworth a day or two back, and so there is pop-up testing running again today in Warkworth. I've had a message I just didn't get a chance to look at from one of our GPs in Warkworth just before I came down, and they're doing a lot of testing up there. My understanding was 6% of the local community had already been tested before today, which is a great effort. Wastewater samples around the country from more than 70 locations have been analysed or are currently being analysed, covering an estimated 3.6 million people. Aside from the known wastewater results in Auckland, Warkworth and Wellington, there are no other positive wastewater results, including from the 5 sites in the Coromandel. On the Pacific community, back to that again, you would have seen, many of you, a tweet from the Ministry yesterday identify that there are some racist remarks and comments being directed at the people in our Samoan community affected by the current outbreak, and this is disappointing and frankly gutless. I'm asking everyone in the country to be kind. The virus is the problem, not people. People are the solution. Be part of the solution. There's a tremendous amount of work going on with this community, and as we have seen in past outbreaks, they're incredibly responsive, and I want to thank all the community leaders who are supporting our efforts to reach out into and ensure that we support and look after that community and identify any cases there, which will be to everyone's benefit. Just around contacts of cases, just the rules around exercise. Anyone who is a contact or who is of a known case or who has been at a place of interest should be at home, and you cannot leave your property to exercise. However, household members who may be staying in the home are able to leave the property to exercise as long as they avoid contacts with others and they do not have symptoms. The Minister, I know, will give some more detail on the vaccine rollout. So 2 other areas I'd just like to cover. One is we are introducing a day 6 test in managed isolation. In the first instance, we are doing that on floors where there has been a case identified either at day 0 or day 3. All the returnees on that same floor whose room is in the vicinity of that case will undergo an additional test at around day 6 or 7. That is in addition to other routine tests. It's just to help us ensure that if there is any spread within a facility, we might detect that earlier than waiting right for the day 12 test. And finally, I've just been briefed on the team before I came down on the incident around the possibility of some people receiving saline instead of the Pfizer vaccine at the Highbrook vaccination site. This occurred on the 12th of July, and there were 732 people vaccinated that day. At the end of the day, at that time, there was a reconciliation process of all the vials, and there was found 1 vial left over that could have been interpreted that some people did not receive the vaccine that day. It's only a possibility. It's not clear that anyone received just a dose of saline rather than vaccine. So there's been a lot of work that's happened since. In the first instance, immediate protocol changes were made to move on all sites to more frequent checking and reconciliation of vials, rather than leaving this to the end of the day. Then if there is a problem found out where the numbers don't reconcile, it's a much smaller group of people who we can define who may have been affected. Secondly, there are labels now put on syringes once they have been drawn up. That's happening everywhere in our large sites. Another thing that's being done is only 1 vial at a time is taken into the place for drawing up. We've been seeking expert advice on this because recalling that this was mid-July that it happened, at that point in time there was no discussion around the country, around the world, around the use of booster or third shots. And this vaccine, the Pfizer vaccine here in New Zealand and everywhere, is approved as a 2-dose regimen. So in this case, where it's not clear that we had some people, a small number, possibly 5, who hadn't received a dose, most of those people would have received a dose. So we've been seeking advice from our technical advisory group on what's the best approach to whether or not people are offered a further dose. Again, I just want to reiterate that it's still not clear that anybody missed out, and if anyone did, it would be 5 of those 732 people who are also scheduled to, and some may already have had a second dose. There's been a full updated review of the evidence going on, including talking to and looking at the experience in Israel, where they have started in some groups doing a third dose, and also there was a similar incident in Queensland, and so we've been talking to counterparts there. Finally, just to summarise what will happen now is that everyone who was involved in that incident will receive a letter within the next 24 hours, and there will be further follow-up discussions with them about what the next steps will be. And again, we're still waiting on the advice of our clinicians and scientists about whether everyone should be offered that third dose or not. But we will keep you updated as that scientific advice comes to hand. Thanks, Minister.
Thank you, Dr. Bloomfield. I'm going to provide a bit more information about vaccines, some information and important information for schools, parents and students, and then a brief word on Parliament. At the moment, we are bringing on board more primary healthcare facilities into the vaccination program. We're bringing on board about 50 per week. By the end of October, by early October, we expect to have around 650 places available where people can be vaccinated over and above the clinics being operated by district health boards. We do know it is important that people can get access to a vaccine with people that they trust, their doctor and their primary care providers. So we are making it as easy as possible for those primary care providers to come on board. We've roughly halved the amount of time it takes to bring them on board into the vaccine program. We've streamlined the way that they are reimbursed for the costs associated with the vaccine program, and we do expect that number to continue to grow. It is free for everybody to get a vaccine, and there will be no charges for the vaccine for anybody in New Zealand. Our specific drive to ensure essential workers are vaccinated is also tracking well. We've seen more than 6,500 essential workers get access to the Pfizer vaccine. Just over the last week. Feedback's been extremely positive from supermarkets in particular. They want to make sure that their staff are protected at Alert Level 4, and we're working with them to ensure that that can happen. From tomorrow, all government border workers are required to be vaccinated. There'll be checks and balances in place to ensure that that happens. That's the first of 2 deadlines we have in place. By the end of September, the wider border workforce who weren't covered by the first required vaccination order for border workers will also need to be vaccinated. These further measures will again strengthen our border requirements and strengthen our protections against COVID-19. To quickly remind you of the daily numbers, 2,932,455 doses of the vaccine have been delivered so far. Over 1 million of those have been in Auckland, so over a third of the doses of vaccine that have been delivered so far have been in the Auckland region. A quick word on education. Some of you may or may not have tuned into the Education Select Committee this morning, where I spoke about the education system's response to COVID-19. We do know that learning from home puts a huge amount of strain on students, on parents, on teachers and on educational leaders. So I want to send a big shout out of thanks to everybody that's involved in ensuring our young people's education continues whilst they are at home at Alert Level 4. We do know that it can be difficult and stressful for teachers in particular, and so we have put in place extra support for teachers through the Employment Assistance Program. That's available from today. It is free of charge, and more information is being distributed about that. We do know that if teachers are feeling the strain of that, they need to talk that through with someone. We want to make sure they can do that. That's available free of charge from today. I've also heard that many schools are making use of the public health order that enables a small number of staff to go on site to get the devices and packs of material to send out to students. Thank you for doing that, and thank you for doing it so carefully and safely. We've made funding available to the Ministry of Education so that they can support schools and kura to meet the costs of providing materials to young people whilst they're learning from home. We're also making sure that learning packs are available centrally where schools are unable to produce them themselves. And we are also particularly focused on getting digital devices out to the young people who need them. So around 7,000 devices should go out in the next few weeks. That's on top of the 36,000 digital devices that we sent out last year. Live education TV has been reactivated, both on TVNZ and Māori TV. That comes on stream from today, and there is also on-demand content online. We'll continue to work to connect households to the internet that aren't connected to the internet where they have learners in them. Finally, a word on Parliament. Select committees are meeting this week to ensure the ongoing scrutiny of government activity. That includes ministers being present at virtual select committee meetings to answer questions on almost every aspect of our COVID-19 response. And to some extent, that is providing a greater question and answer opportunity for members of Parliament than would be the case if Parliament was sitting as normal. We are very mindful of the need for that scrutiny, and we're also very mindful of the need for Parliament to be able to come together sooner rather than later. So the government's view is that we should explore all opportunities for Parliament to be able to meet virtually rather than travelling here to Wellington at the current point in time. And we will work with the Speaker and the Business Committee to explore all of the ways that could be done. Other parliaments around the world have used remote meeting technology to allow them to continue to undertake all of their functions whilst restrictions are in place, and that is something that we'll be actively exploring here in New Zealand. And we'll do that through the Speaker and through the Business Committee, and of course we will aim to reach a consensus on that if we can do. And I ask simply that all other parties participate in that process constructively. Now I open up for questions. Mikey.
Minister, Pacific medical providers say that they've been operating some of the vaccination centres from the beginning, but that they told the Ministry of Health they needed to be going into churches and they wanted to see things like group bookings. Why was their advice not taken on board?
I don't necessarily agree with that. In fact, I've heard reports of where Pacific health providers have gone into church congregations in the weekends, for example, and offered a pop-up vaccination clinic after a church service. Obviously not in the last week, but I am aware that that has happened up until now. So, look, I'm happy to look more at the who's raising the concern and why they're raising that particular concern, but we've seen examples of where that's already been happening.
Are you confident, though, that it's been happening on a large enough scale and that there has been trust towards the Pacific medical providers to be able to engage with their communities in the best way that they know how?
Well, I can absolutely confirm that we have good relationships with our Pacific health providers, our Māori health providers, and that now that we're getting into the point where we're making vaccines available to just about all of the population, next week it will be available to all of the population, those sorts of pop-up events where there are gatherings of people, at such time as those gatherings are able to resume, will be able to become a more integral part of our vaccination program.
Why are COVID positive cases having to wait to get into the jet park, and what are you doing to monitor those who are having to isolate at home?
There is capacity at the jet park at the moment, so there may be some logistical considerations around that, but we have capacity at the jet park to be able to accommodate positive cases. So it will be a public health consideration rather than an MIQ consideration that's driving that. We are also currently in the purpose of readying another facility to take quarantine people in the event that we need that, and it is looking likely that we would need that given the number of cases that we're seeing. So we're preparing that facility now so that we will have those rooms available if case numbers continue to grow.
On the saline issue, why did you not contact those 732 people who got the jab that day before it broke in the media? You've had more than a month to contact them and have not heard anything from you. Is that good enough?
Yeah, 2 points just to reiterate. The first is that it was there was an immediate interview done with all the vaccinators, and none of them could think of anything in their process that might have explained the leftover vials. So it was not clear that, in fact, anyone had missed out. So there's been a thorough investigation into that in the meantime, not leaving it to chance and making changes anyway to rule out the possibility that could happen again. But the second was just that then what the expert advice was to actually do in this situation, and we've been seeking that advice, working closely with the DHB up there. Minister, if I could just add a point on to the previous question. The reason for the delay is, you can imagine, with 40 or over 60 cases, part of the issue is safe transportation of people to the managed isolation or quarantine facility as well. So it would be a transportation issue. Sorry, and the second comment is just an update on Warkworth. As it's been confirmed, there is a positive case who lives in Warkworth that is likely to explain the positive wastewater there. Sorry.
We'll come to Jane and then Joe.
At what point was the decision made to send those letters out to those people?
Look, it will have been made now that the news is out, but
since RNZ started making inquiries.
Yes.
Why not before?
Just as I explained just earlier on, the key reason here is we were waiting for advice from our clinicians on the best way to deal with this particular situation. And I do want to point out there was a range of views. Some felt because there was actually quite a low possibility that 5 of those 732 people may have got either saline or a diluted dose of the vaccine, that actually, because there was quite a lot of uncertainty, there was no need necessarily to do anything. So we were waiting for our firm clinical advice on that.
Was there a decision made? Was there a discussion about not going public? What was the upshot of that discussion, and was there ever a decision made not to go public?
No decision had been made. As I say, there was a range of views. We had been involved in those discussions, and quite a lot of discussion between the Ministry and the DHB, based on the emerging evidence from the review that was being undertaken.
Public at any time over the last 7 weeks, even if there's a possibility that 5 people are walking around thinking they're not vaccinated, and say, look, there's a problem. We're going to put the date out, we're going to put the centre out so that people can be aware. And also the lapse of time in actually giving people a day. I mean, why did you not take that approach? If you weren't sure whether people were vaccinated or not, wouldn't it be to err on the side of caution to go public and tell people that they may not have had
Indeed, these were all the issues that were being canvassed, including with expert clinical input. So on that day, 421 people were actually receiving their second dose and 311 their first dose. Since then, 286 of that 311 have had their second dose. So virtually everyone in this group has had at least 1, if not 2, and it may well be that all of them are fully vaccinated. So we were looking to see what other jurisdictions, like Queensland, had done in this instance, and awaiting our expert advice.
If it hadn't broken the story today, would those people have been contacted?
Yes, that was always the intention.
Joe.
Just on the Crown Plaza investigation, we know that the family that contracted Delta from the Sydney returnee, the door opened, the family adjacent ended up contracting it at some point between August 7th and 9th when the Sydney returnee was still there. That family then went for a walk in the exercise area on August the 12th. Do you know from CCTV footage whether any members of the public were using that walkway, which does not have a lid, it is the same airspace as the exercise area, and if so, have you identified those people?
So they've done a fairly thorough review of anybody who may have potentially been at any place around the jet park at any time when there could have been risk, and they have been contacting and ensuring that people are being tested.
Crown Plaza, I'm not talking about jet park.
Oh, sorry, you're talking about the jet park. Sorry, I'm talking about the Crown Plaza. Yes.
Jet park.
Yeah.
Okay, so
sorry, did I say jet park? I mean Crown Plaza.
So just to clarify, you don't know whether anyone was using that walkway that uses the same airspace when that family, who were already positive because they had picked it up from between the 7th and 9th, on the 12th, they were using the exercise area. You don't know if any members of the public were using that walkway at the time.
There has been a very, very thorough case investigation around everybody who was in or around the Crown Plaza at any time of of risk to identify anybody and to identify who they are and make sure that they have been tested. On the walkway in particular, I'll ask Dr. Bloomfield to provide a comment.
I don't have any specific information, but we can come back to you on whether the CCTV footage of that specific incident where the members of the family from the room next door were exercising, whether there was anyone using that walkway.
All right, that's where we'll leave the press conference today. But if you're wanting to watch the rest of it, head to our website, onenews.co.nz, for the balance of the question and answer session. Here are the main points from the press conference. There are 62 new community cases today. Dr. Bloomfield saying it's reassuring that case numbers are growing steadily rather than exponentially. And that makes the total from this outbreak now 210. 198 of those are in Auckland, 12 are in the capital. 12 people are receiving hospital care, up 3 from yesterday, but no one is in intensive care. And some good news, 80,000 people got vaccinated yesterday, and those over 30 are now eligible for the vaccine. And remember to keep checking the Ministry of Health's website for locations of interest, as there are now more than 480 of those. And we'll be back with more COVID coverage at 6 o'clock. Of course, Te Karere will be here at 4 in the meantime. Have a good afternoon.